Good afternoon. Thank you so much for letting me meet with you guys to explore expanding the apheresis services at UT Southwestern. The UT Southwestern Clinic was established in 2011 and began with 3 nurses and 700 visits. Over the years, we have grown to 3,000 visits a year, and also due to our growth, we have received a new unit with 18 rooms and 1,600 square feet. Each patient has a private room, and it is conducive to treatments. The UT Southwestern Clinic provides the future of medicine today with its involvement in research and quality improvement. We are currently active in 7 research studies, including 2 multi-center studies, and we are active members of the American Society of Apheresis. We annually participate with poster and podium presentations, and of note, our chair of our department, Dr. Cervoti, was past president of ASFA. The apheresis care delivery system includes one-to-one nursing care. And of note, our nurses come from diverse backgrounds, but the majority of them have ICU training with an average of 18 years of nursing experience. Additionally, the apheresis nurses receive training from the clinical specialists and also receive annual refresher courses with advanced troubleshooting and procedure efficiencies. Currently, at UT Southwestern, we do not offer LDL apheresis. UT Southwestern services the North Texas region, offering outpatient therapeutic apheresis procedures. The DFW Metroplex population is an estimated 7.69 million people, and LDL apheresis is approved by the FDA for familial hyperlipidemia and recently was approved for focal segmental glomerulosclerosis. There is no current active LDL apheresis program that treats these patients' diagnoses in the whole entire state of Texas. FH is pretty prevalent in the population. 1 in 250 people are affected with familial hypercholesterolemia, and approximately yielding 1.5 million Americans that are affected with this disease. LDL apheresis is a treatment option for these patients that have not met treatment goals despite optimal medication therapy. LDL apheresis can increase life expectancy to up to 50 years or greater. FSGS is not as prevalent as FH, only affecting 7 people per million, but still accounts for 40% of adults in nephrotic syndrome. Of note, FSGS accounts to 5 to 20% of all people experiencing end-stage renal disease. And LDL apheresis has been proven as a treatment option to create remission in these population of patients with an efficiency of 50 to 80% of the patients that receive LDL apheresis will achieve remission. UT Southwestern is known for its specialty clinics. UT Southwestern is recognized as a center of excellence from the FH Foundation. UT Southwestern has active members, and the FH Foundation is receiving external referrals from all Texas regions and surrounding states for the treatment of FH. Additionally, our nephrology clinic and subspecialty clinics treat FSGS. And UT Southwestern has an active transplant program, transplanting about 150 kidneys per year. To start the LDL program at UT Southwestern, the estimated initial cost is $20,000. The initial cost will cover the machine setup, service agreement, the training of the apheresis staff. And of note, since we received our new space with 6,700 square feet and 18 private rooms, we would need no additional space to perform these additional procedures or staffing. Like mentioned before, currently there is no active LDL apheresis programs in the state of Texas. And our marketing plan will include collaboration with UT Southwestern Marketing to update our website, create a one-page flyer that could be used to advertise the treatment in the Texas region. And then also we'll be using internal advertisement in the weekly health system roundups advertising the expansion of the apheresis services to include LDL. The manufacturer of the LDL apheresis system, Kinetica, will also participate in providing in-services to local community doctors on the benefits of LDL apheresis, and they also agreed to provide a speaker for our ground rounds to raise awareness of the efficiencies of LDL apheresis and treatment options for patients with FH and FSGS. Kinetica has also agreed to perform a market analysis to predict the potential amount of patients that are in the Dallas-Fort Worth area and surrounding communities. The timeline to launch a project will be about 6 months, and the project will consist of contract negotiations with Kinetica, updating our website and marketing plan, and training of the staff. The training will take place about 1 week prior to patient day 1. The projected volumes for year 1, as you notice, for the 6 months, the first 6 months, there is no patient volumes, and that is the time that it would take to negotiate the contract, initiate training, and prepare for our first patient day 1. After that, if you notice, once we initiate the program, we anticipate that for the last 6 months of the year, we would have a total of 5 patients receiving 72 treatments. The reason that we expect 72 treatments with LDL apheresis, for FSGS patients, they receive an average of 12 treatments for their treatment course, and for FH patients, they receive a treatment once a week, every other week, so yielding 2 treatments per month. So year 2 projections, once a program is established, we're anticipating 20 patients and an estimated 480 treatments per year. So as you notice, our revenue has increased to roughly $400,000 per year. Year 3, we predict 25 to 30 patients for that year, yielding 530 patients. Sorry about that, 530 treatments. And then again, with an average revenue of $400,000. And then at this point, at year 3, we would focus heavily on advertising to the surrounding states, and again, ensuring that our program is solid. In conclusion, the addition of LDL apheresis program will align with UT Southwestern mission of promoting health and healthy society that enables individuals to achieve their full potential. We educate, discover, and heal. It also aligns with our values of excellence, innovation, teamwork, and compassion. And of note, there is no additional space requirements that is needed or personnel to initiate this treatment. We have also had some interest from our local nephrologist and our cardiologist stating that they would consider this treatment for their patients that have failed medication and other therapies. At this time, I would like to entertain any questions, and thank you again for your time and attention.